Hello everyone, my name's Norman Hall and welcome to Star Business Solutions 2021 webinar series. Today we're having an industry and products specific webinar as opposed to one of our normal green tree or advanced type webinars. So once again, welcome for joining us today. Today we'll be going through a short welcome and introductions, then we'll be talking about the platform technology, token assist, broadcast messenger, resident reporting, and then we'll have a Q&A time at the end. I'd appreciate if you could write down your questions that you have in the question area, and we will address all of the questions at the end. We have plenty of time today, so lots of questions will be appreciated. We are recording this webinar today, and a link will be sent to everyone, and we'll also provide a copy of the recording on YouTube after the event. As I said, my name's Norman Hall. I'm the Director of Marketing for Star Business Solutions. Our guest presenter today is Yolanda Kildare from TOKN Technology, and the panelist who will be joining us for Q&A time is Joshua Diffie, General Manager for Sales for Star Business Solutions. Now I will hand it over to Yolanda, and she will do most of the heavy lifting today. All yours, Yolanda.
All right, thank you so much, Norman. So I'm hoping that you guys can actually see my screen there. So thanks for having us today. So today what I'll sort of aim to take you through is a number of different things. So just a very high level on TOKN's platform technology. So for those of you who haven't heard of us before, we give you a little rundown as to what it is that we do in a general sense. Then we'll get a little bit more specific in terms of some of the current challenges we've sort of noticed in the care industry with the clients that we've sort of dealt with. And then we'll move on to showing you some of the solutions that we've created to solve for some of those problems. So I guess what's always good is just to start off with a little bit of a definition. iPaaS, which is integration platform as a service, is kind of an emerging sort of technology. Some businesses are very familiar, other businesses haven't heard of it before at all. So just to give you a very high level as to what iPaaS is, it is an integration platform. Essentially is usually a cloud service and usually allows data to be delivered from one endpoint to another endpoint. And that happens through integration. And this just allows connectivity between multiple systems or to bring data out of existing systems and be able to use that data to create different processes and workflows. So usually it's designed for enterprise style businesses, but in our case, it's usually any business that has large software that might be a little bit older and is expensive to overhaul, and instead of doing that, they'll use an integration platform to try to integrate it into other newer pieces of technology, or bring that data out of that older system and build different workflows and processes to deploy onto mobile equipment, as in mobile phones, iPads, or desktop computers. So sometimes it's easier to see a little bit of an illustration. So this is essentially a infographic that explains essentially how a integration platform works, and specifically our integration platform. So in the middle there, you'll see the TOKN platform. That is a cloud-based platform and essentially will sit between two things. So the first thing on the left-hand side, you'll see under that number one connect area will be different types of ERP systems. So we can essentially connect into any system that has an open API or any data source that is open for us to be able to connect into. So you'll see a couple of examples there of ones we've connected into before. Some that aren't mentioned there are MYOB, Green Tree, and obviously MYOB Advanced as well. we have quite a few clientele that we've used integration into those systems. And I know a lot of you on the call today use those systems. We certainly can integrate into those, but it's really limitless. We are sort of software agnostic in terms of what we can connect into, as long as we've got an open source that we can connect into. So once we connect into those systems, essentially we are able to bring data out of those systems, house it in our cloud, and do one of two things. We can either build a workflow that is housed in our cloud. So we can build a process that's housed and data is stored in our cloud platform, and essentially a worker can use our platform to work out of, or we can deploy it onto mobile or tablet as well, or desktop applications. So once we've brought the data through, we use the cloud to build a workflow, and then we deploy onto mobile or desktop applications. So while we're an integration platform, one other thing that we are is also a low-code platform. So we're able to develop solutions pretty easily and quickly through a couple of different ways. So we've got a lot of templates that sit within our platform, so we can deploy those pretty easily, bringing in data from any piece of software. Or we can build a solution pretty quickly as well using our low-code platform. Okay, so the types of businesses that find, our solution handy are usually businesses that have a mobile workforce. So what you'll see in the middle there are some of the industries that we've worked in, and we kind of started in that mining and construction area purely because they have a mobile workforce and they've got people out in the field, they're out in remote locations, they don't have access to computers, but they need to be able to access the system to complete a form or send information back to a primary system. Now, over time, we've sort of still working in that area, but we've found ourselves a lot working in the care industry. And one of the things that the care industry has in common with mining and construction is they have a mobile workforce. So a workforce that is disparate and sort of spread out, that aren't necessarily sitting in front of computers, but they still need to be able to access certain systems and or fill out any information and forms, and that data needing to be sent back to a primary system. So that's where we've kind of found ourselves, in that aged care and community care space as well. One of the other bits of technology that's quite popular with our platform is we do have an offline technology. All that means is essentially if you've got workers who are out in random locations where reception might not be that great, we do have the ability to house data within our app and send it back once they are in an area that's got reception as well. So the systems don't essentially shut off when there's no mobile reception. So that's just a really high level overview as to how our platform works and platform technology works. So some of the things that we've kind of noticed as we've gotten into this care industry is some of the challenges that are faced are quite similar to some of the initial industries that we worked in, which is that mining construction area, but there's still a lot of heavily paper-based and manual processes within this type of industry. So just to give you an example, some of the solutions that we've created are for clients who have a workforce that are mobile, say a group of carers that are going out to multiple different homes during a day. And essentially a lot of their process is housed on paper. So they're filling out paper forms, they're scanning and emailing those back to a back office or handing them into a receptionist who then will enter it into a primary system. So very paper-based, very manual. We've also found that a lot of the systems that they've got are quite dated and older systems. And the reason for this, obviously, with healthcare systems, they're quite expensive. They're expensive to overhaul. Replacing a healthcare system isn't always a viable option for a business. So they tend to hold on to software for a really long time. The systems are quite disconnected, so they don't necessarily talk to each other. And because of all of that, there's a lack of data that comes out and analytics that come out that can be used to help improve business processes and essentially improve the care of patients, which is the most important bit here. And all of this generally comes around because there's, a lack of support and funding within the industry. We know that within that healthcare industry, a lot of the spend that they will make is based on, funding that they're able to get a hold of. So it's just one of those industries that it's not necessarily forgotten, but it's got a little bit left behind with technology, and hence why we've got such a bit of an uptake here, using platform technology to try to bring them into, newer age technology without having to replace all of their internal systems. So I had a little interesting quote here on the side. So only 1 in 3 aged care facilities have a holistic consumer record of information. So this is something I got from the Aged Care IT Industry Council. So if you are within the aged care industry and you haven't heard of this council, it's definitely a good idea to jump on their website and have a look. They're really quite good in doing a bit of background research in terms of what is missing in terms of technology within the aged care industry specifically, and some really handy points and bits of information to take away there in terms of what technology to use. But I thought that quote was really interesting to make a point here of the lack of connectivity. So that's sort of the challenges that we've noticed. Now, how have we looked to sort of solve some of those problems? So I'll take you through some of the products that we've been able to develop in conjunction with our clients, and take you through essentially what they are and how they're helping. So let's start off with our TOKN Assist app. So this app came about because we had a particular client who had come to us and said, hey, I have a really large mobile workforce of carers that are out in the field, and they're doing home visits to go in and visit clients and check on their welfare and well-being, and administer medication, things like that, your standard sort of healthcare home visits. But the current process is they print out a list of appointments at the beginning of every day. They put them into essentially what is a pigeonhole, if everybody remembers a pigeonhole, and the carer will come into the morning into the office, collect their stack of paper, and then off they'll go on to their appointments. So each piece of paper would have a client's details on it, obviously, so where they live, obviously information about what needs to be done on that appointment, and then essentially go off on their way and start going out to their appointments. Once they've completed their day and they've filled in all their pieces of paper with their information, that information is then dropped back into the office into a pigeonhole, and you have usually an admin person sitting there entering all that data into a primary system. So they were really looking at a way of digitizing this process, and also being able to keep a viable record of information. We all know with healthcare, storing of data is something that's really important, and being able to retrieve that data when necessary is really important as well. So we came up with this TOKN Assist app, and essentially what the app allows them to do is we've connected in their schedule, so we can bring in a schedule for a particular carer, and we've deployed this to a mobile phone. Okay, so every carer has the TOKN app on their mobile phone, which they're able to open up at the beginning of every day, and they'll see a list of their scheduled appointments that they've got to go to. We've put them in order for them in chronological order, and we've given them all the information they basically need for that appointment, and they're able to essentially input information about the appointment, hit a submit button, and we'll essentially store that data for the client. So just to give you a bit of a visual as to how this looks. So this is how the appointment schedule will look. So you come in, you start your day in the morning, you open up your app, here's your schedule for the day. It's got all of the details there that you need to know about the client, their street address, the duration, etc., and what time you're due there. It does have a Google Maps integration. So one of the cool things about the TOKN platform is that we can essentially connect to any endpoint on a device. So if you've got Google Maps available, we're able to connect to that endpoint and essentially pull that in and build that in as part of our application process. So integration is there for Google Maps, so if you can click through there and go straight to your appointment. Once you get to your appointment, you can just click on the actual appointment time, and your client's details will pop up. So it has information about obviously their name, address, what they're needing for that day. it gives you the ability to add in comments. So, any comments about, you can see there, patient in high spirits, needs regular check-ins, reschedule appointment for 2 weeks' time. We've got a duration of the appointment there as well. And then at the end of that appointment, you're able to get a signature from that client. So it's a full process from appointment all the way to completed appointment on that one application. And once they've gone through that entire process, that is then moved to the bottom of the list and is tagged as completed. So you can quickly see, going from a very paper-based process of having a piece of paper and scribbling down and then sending that into a back office to have it manually inputted back into a system. This is one simple way to have digitized this process completely and have it all in one place and a digital record of that visit with that client. So it goes without saying, but some of the benefits that have come through as the use of this app, this Token Assist app, was obviously removal of that manual process, as I mentioned, no duplication and doubling in entry. It also ensures that pieces of paper don't get lost. Paper isn't necessarily that reliable, and people tend to lose it and things go missing. So we've got an actual record that we can keep. Our Token cloud has the ability to store data. So just so you know, if there is an application that we need to build and you need somewhere to store data for a particular process, we can actually house that within our platform as well, and you can retrieve that data whenever you need it. Obviously, improvement in the visibility of real-time appointments and client schedules, and obviously having that digital record, as I mentioned, and increased customer satisfaction as well. Often you'll have a primary caregiver of a patient who'll want to see information about the different appointments that you've gone to visit their family member, as an example. This way you've got a digital record and you'll be able to sort of go through and show them that information. And you've also got a connected workforce as well. So you're able to sort of see what everybody's doing at any given moment of the day and be able to see how people are progressing with their appointments and things that might need to be picked up or handled in the field as well. Okay. So that's just a Token Assist app. So that's one solution that we kind of created there for one of our clients. Another really popular piece here is our Token Broadcast Messenger. So this was actually initially created for a mining client, and they have obviously a disparate workforce that work in quite regional communities out in Australia, but also need to be able to keep updated on any emergencies. So as you know, if you're working in remote parts of WA, as an example, you might need to be alerted about weather warnings. Cyclones come in, lots of different things can impact safety in the workplace. So we actually established this way of being able to communicate with all of the employees through the application. So we can essentially send a push message through to the application, and that can be controlled from our platform by the client. So they can jump in, send out an alert message, and it can just be a pop-up message, as you see there on the screen if it's an urgent message, and they'll have to click to confirm to say that they've actually read that message. This also gives you a digital record of who is aware of whatever hazards are out in the field at the time, or you can just pop it into our broadcast messenger, as you see on the left there. We can just pop in a particular notification. So this whole broadcast area is really a way to keep your workforce engaged. So you can add in a number of different things here. Not only do we have the ability to send out alerts, but you can also put in things like updates about the business. So you can see there on the right, we've got a community tab and a newsfeed tab. This is a great way to replace things like an intranet, right? So you're able to include information about your company, information that your workforce might need to know about, and information that you think is handy and or urgent. So this is all housed, again, on a mobile application for our client here, and they're able to essentially send out information to their workforce without needing them to log into any particular intranet, and have a reliable way of knowing whether or not the message has been received with that confirm button there as well. Okay, so that's our broadcast messenger. And then our most recent one, quite a popular one. So what we noticed when we were talking to our care community, and this particular one is specifically for disability services, but what we noticed was with the system that they were using, and these guys use Greentree, just as an example for those on the call who use Greentree, they weren't able to bring out GL financial data out of the system and be able to present it to clients. Now, why is this important? So if you just envision the way a practice would work, you've got a whole bunch of people in care, and then you've got a primary caregiver who's often outside of that facility, obviously, but needs to be able to check in information as to whether or not the person in care has the necessary funds they need to purchase things while they're in care. So as an example, you might have a family member who's in care, and at the beginning of every season, they need an allowance for clothing. As an example, it might be $200, $300 for, summer or winter clothing at the beginning of that season. So the way the process was handled initially was that, a letter was sent out by post with a request, then that request would have to come back in, and then there would be essentially money that was sort of issued out for this transaction to take place, but there was no actual digital visibility on exactly how much money was sitting in the kitty for that particular person in care and exactly how much money had been used in terms of expenses. Okay, so expenses can come in obviously many different forms for a person in care. It might be things like, they need health appointments, medication, clothing, different things like that. Lots of expenses sort of coming in and out. There was not really a way digitally to present that information to the primary caregiver. So what we essentially built was a resident reporting application. This is a 100% automated report, and essentially we'll be able to pull out information directly from Greentree, and it's housed in a report within the TOKN console. So what does it look like? So we've got the first little bit at the top left. So you're able to search a resident by a specific name and date range. Now, important to note here that each particular resident or family member that's accessing this information only has access to the information for their particular family member in the system. So TOKN does have a whole bunch of security built into the platform, and we also have what we call bi-factor authentication. So we're able to authenticate that a user is who they say they are. So usually if they're using a mobile device, the way we would do that is send through a little text message with a code, and they'll have to essentially input that code back in to confirm that they are who they say they are, essentially. So similar to what you've got with your banking services and things like that. So we've got that kind of security. Obviously, this is financial information, so that kind of security is important. So once you've searched, obviously, by your family member, if you might have multiple family members in care and you've put in a particular date range, and you want to basically then have a look at what money you've sent into the kitty for that particular patient in care, but then also what expenses have been debited out of that kitty, and then obviously what the closing balance is there. So we've built this all into one single automated report for our client here. So you can see I've just used myself here in some dummy data as an example. There's the opening balance at the beginning of the month. So I've looked at the month of January as an example here. I've got a full opening balance. You can see other income that's been put into that particular kitty by a family member as an example. And then you'll be able to see here on the right there all of the different expenses that are being deducted from that particular kitty. That's the total amount that's been deducted, and then you'll be able to see what the balance of funds on hand are at the bottom there. So this bit of visibility has been, absolute game changer for our client here. So the process that they had before was essentially they were pulling the information out of the Greentree system using a Excel spreadsheet that they had built to basically calculate the information. Then they were essentially getting the expenses into the system by scanning these different barcodes into the system, and essentially then having to manually type up individual letters that they were sending out at the end of every month to their primary caregiver of the residents in care. So this has saved them quite a lot of time. Now the residents and primary caregivers can jump into the system, have a look at exactly what their current balance is and all expenses that have been lodged, and they're all housed in the TOKN platform. So we basically use this data and look at this data and be able to visualize it for them. We're not obviously storing their financial information, but they have access to be able to see this information at any given time. So some of the benefits here, obviously, they've got real-time visibility on resident financial information. All of the reports are 100% automated, and they are fully integrated. So there's no manual work involved here. There's no back office duplication or manual entry of data or manual sending of posted letters out at the end of every month. And obviously, their primary caregivers of the residents are really impressed with the fact that they're able to sort of check this information at any given time and be able to add money into the kitty if they need to, or know that everything's handled and it's sort of okay. So it gives them a bit of peace of mind there as well. So that's our resident reporting application there as well. So just a little bit here from one of our clients, TPG Aged Care, which is one of our very first clients that we got on within the sort of community care industry. And they've just come in and said reducing time to distribute our rosters every day, knowing no one will be missed, is a really great outcome for us. And David Madigan has basically said that they've been able to save 592 hours a year in administration tasks just by implementing a solution like this. So there's obviously many different solutions that we can create, but this just gives you a really high level overview of some of the popular ones that we've come up with and some of the ones that solve for some of the challenging, pressing issues within the care industry at the moment. Great, so you can find out more information on our website. We have plenty of information there. We've got brochures and things you can download, lots of videos that you can watch. But I think at the end of this, we will sort of send out obviously a recording of this, but links to the TOKN website and other bits of information that you might need, and my contact details as well. So I'll hand back over to you, Norman.
Thank you, Yolanda. I'm just changing the screen. Working from home is not quite as easy as working in the office. Anyway, thank you, Yolanda, for that. I learned a few things, and hopefully our attendees did as well. We've got a number of questions that have come through aimed at you specifically and generically, so hopefully between Josh and yourself we will have some good answers. First question that I see is, can any of these solutions be customized to the specific business requirements? And I presume it is, like I saw one of your screenshots had images of the client's logo on it. So I presume they mean along those lines, but it may also mean for added functionality.
Yeah, absolutely. So we can certainly customize any of our solutions to suit business requirements. And that's some of the benefit of being able to use an integration platform, is you can take a concept of something that you might need and that there might be already sort of another SaaS solution out there that solves a bit of that problem, but you might need to customize that slightly for your business. And that's where we kind of come in, and we're able to customize solutions for businesses. We can also white label, so everything is branded to your business. Unless you tell your workforce, nobody will know that you're actually using the TOKN platform as a way to build your application. So we try to keep it really bespoke and specific to each of our clients' businesses.
Okay, thanks for that. Where is the data actually stored?
So our data is stored in AWS, so that's Amazon Web Services. All is stored in Australia. So we have our Amazon primary storage is in Sydney. So we can house, as I mentioned there in the presentation, storage of data within our system. So if you have a bespoke process that you would like to be deployed onto an application, but you don't necessarily need it connected into a particular system, it's just a process you'd like to house in Token platform, you can do that. And that information and data we'll keep in our Amazon storage and be able to retrieve that data as and when you need it.
Okay, thanks. Next, I noticed that Token has a number of pre-built solutions. I'm interested in Safety 360. Can I mix it with the care apps?
Yeah, absolutely. So you can take any sort of number of applications with the Token solutions. So as I mentioned there, we sort of work across a number of different industries, and none of our solutions are created so that they only work for a particular industry. So if you'd like to blend in the safety apps, or we might even have things like timesheeting that you might have seen with us before, you can absolutely blend those apps in and take them as a suite, and we can connect them together if we need to, and push data to and from multiple different systems at the same time.
Okay, this one I think might be more Josh oriented. Josh, if you want to take yourself off mute. We're using service orders within MYOB Advanced for managing maintenance for a number of residential facilities. Oh, sorry, it is more Yolanda. Can Token help with maintenance checklists?
Yeah, absolutely. We can certainly build checklists. So with maintenance, so this is another one that's kind of cross industry, we do a lot of physical maintenance checklists within mining and construction. So we can absolutely have that transferable across to aged care. Everything we do is customized, so we can build in a number of different checklists as you need them. And as mentioned, that data can be housed in the Token Cloud platform, and you can access that data as and when you need it as well.
Right, okay. The next one, you talked about authentication for carers. Sorry, Yolanda, I can't remember the exact words you used, but they've said that you used user authentications.
Yeah.
How do you use user authentications for staff to make sure that staff only get access to the
right info
and access to the right information?
Yeah, absolutely. So a number of different ways we can do that. So essentially, how we set you up in the Token platform is we'll use your mobile number as a unique identifier. So whoever has admin access to that particular company will set up a whole list of users in the system and associate a mobile number with them. We authenticate you by using your mobile number to make sure that you are who you say you are. The second part to that is how do we make sure that people don't get access to information that they're not supposed to have access to. So there's a number of different things we can do. So within the Token platform, we can actually build in different user roles that have different visibility allowances. So we can cater for that within the Token platform. Or if you're a larger organization and you have user role or visibility allowances based on user role that might be housed in a different system, as an example, Active Directory. We can integrate with Active Directory, and we can use the data in Active Directory to establish a hierarchy in terms of what information a particular user can see. So a number of different ways we can do it, but we absolutely can handle that and have handled that for particularly that last solution that you saw there with the resident reporting. We've got different accessibility for primary caregivers who are external to an organisation, internal employees, and then super admin employees who have full control over the system. So we can absolutely cater for that as well.
Okay. Yolanda, can the data be exported for reporting purposes?
Yes, so we have the ability to export into a number of different file formats. Obviously, the most popular one is usually export to CSV to Excel, So absolutely, we can export data. As I mentioned, it's all stored in the Token cloud, so we've always got a backup there. We can export data. We can also build reports within the Token platform if you need to as well, and make the data a bit more visual. So it all just depends on your requirements and how you want to use the system. But absolutely, can build reports, and we can allow you to export data in multiple formats as well.
Right. Okay. Only one more question at the moment, so please feel free to add more questions if anyone has any. Obviously, I think someone's been looking at your website a bit. How have you found speech to text in taking notes?
So we haven't actually implemented it for anybody, surprisingly. Nobody's really requested it, but as I mentioned, we do have access to all endpoints on a device. So if you would like a speech to text option, we can certainly look to build that into a solution for you. It'll work very similar to how it works right now if you've got a smartphone, and if you do like I do all the time, if I'm driving and I need to send a text message, I'm usually talking to my phone and it's texting for me. We absolutely can connect it to that endpoint on a device and use that technology, and it will work similarly to that as well.
Okay, well, that was the last question on the list. I'll just give it a moment in case anyone has any more questions. No, nobody's typing anything. Okay, look, if you do have any more questions, please feel free to email them to me, and I will ask Josh or Yolanda to answer them for you. Thank you for your time today. We will be sending out a copy or a link to the recording of today's webinar. Just as a bit of an information background-wise, at STAR, we do have quite a few customers in the community care, healthcare, home services, community health area. One of our staff members is actually a qualified nurse, having a Bachelor of Nursing and also a Bachelor of Health Administration, and they've spent quite a number of years both on effectively, I suppose, your side of the table, as well as in the software side of it. So we do have a fair bit of experience there. Please feel free to contact us or Yolanda if you have specific questions for her. And if we can help you out, that would be fantastic. So have a nice day, and that's the end of today's presentation.